And this brings us to, I talked about the Southside Health and Vitality Studies. We have two major thrusts of the studies right now. One is really getting at pinpointing the assets that exist in communities, both the built environment as well as the service environment, and I'll speak to that in a few moments. The other is trying to do this population-based study on the South Side, again, in collaboration with community. And aim one is basically just figuring out what assets are there, what are the community's awareness of the assets, and how are communities using the assets to enable and promote health. The second aim is trying to figure out how those link to our community's perceived and evaluated health. And as you get to aim three, and I should just point out the DCT it's an acronym for Digital Communication Technology. And that could be having the internet, a computer at home. It could be a smartphone. It can be texting. It can be how people digitally communicate with one another. And so our third aim is looking at how having access to digital communication technology helps one be aware of the assets in one community. So that could be that you have an internet connection and you're able to look on our website to find out what assets are arrayed in the community. And then the last aim of the study we have proposed is how digital communication technology may help enable or be a conduit to good perceived or evaluated health, or alternatively a substitute for good or perceived health. And so to the extent that someone can look on the internet and find information that can keep them out of the emergency room, that might be a good use of technology and may help people get to a good health state without having a taxing emergency room resources, for example. So we will keep your fingers crossed on this particular R01. We'll be hearing about this in the next month or so. But one of the big things I do for all of the things I'm talking about is raise money. So I spend a fair amount of time traveling the country, shaking trees to try and fund the work we're doing. In fact, I've learned how to ask for $100 million without laughing, because I'd be like, I need $100 million. No, really. So I used to laugh when I do it, but now I can keep a straight face when I ask for a whole lot of money. And this is just a map of the south side of Chicago. The darkly demarcated line around is there's 77 community areas in Chicago. Our definition of the South Side comprises 34 of those community areas. It's about a 95 square mile area with, now with the new census data coming out, it used to be about 1.1 million people, and it's down to 800,000 people, given the Robert Taylor homes, which was the largest housing development in the country, has been torn down, and a lot of the low-income individuals that live there are now in surrounding suburbs and elsewhere in the city. So, just want to give you a sense of that landscape. This just demographically, you have among the richest African Americans you can find, the most socially well-off, like the President of the United States. At the same time, you have not far away a lot of low-income African Americans. The South Side across the board is about 70% African American, though different communities within the South Side are more hyper-segregated than others. If you see the asterisk here is where the University of Chicago sits. We're surrounded, and again, the darker it is the higher percentage of those who make less than $25,000. So you have the University of Chicago surrounded by some of the poorest areas in the city. And so what we've done is actually create a census for 11 of those 34 community areas, where we've gone block by block to find every park, every grocery store, every church, and as you can see, the dark blue line goes around the 11 community areas that we've had the built environment mapped out. We then felt the need to go back and do a service mapping, because while you might see a church, we don't know if there's a food pantry in there or an adult day health care or any other services. So we've done five communities or six communities, I should say, where we've done both the built environment and service mapping, and this is a largely Latino area, while these areas are predominantly African American, and so this is the South Side. This is where we're doing all our work. It's not a small area, geographic area, as you might find. We've as I talk about the asset mapping, we've had college students initially go out, University of Chicago students go out and walk the blocks along with community participants, community workers actually. We hired community individuals to participate in this project. And it's been eye-opening for both of the participants. First of all, this is a quote from one of the students. He said, "We cared about the project. It was interesting. It had a goal. It would do something for the community. It was worthwhile. We felt like a little more than data collectors. We felt like social workers in a way." So that was our first summer when we did this. The second summer, we were approached by a community development corp who had some dollars for high school students to do something. And they said, "We heard about this asset mapping you're doing. We would like to have our students do asset mapping." And so, we ended up partnering with them, giving them our technology. We actually matched some of the money that they brought to the table. And this is the greater Auburn Gresham. And this is where, Monica, you live in Auburn Gresham as I'm thinking about this. And the students, I have to tell you, had a phenomenal summer. They ended up finding out about resources that they didn't know existed in the communities in which they lived. And it ended up being an opportunity where the merchants got to see these young people in a very different way than they're accustomed to seeing them. So it was a win-win. We had people for the first time who were interested in health professions and being involved in research, all because of this one experience. And just to give you a taste of that, this is one student's comment. "I'm happy to be a part of the mapping group because we're helping the community by letting them know what is around them and by helping them not have to leave the community for something that they already have close to them." Because certainly, on the South Side, as in many urban communities, there's an exit of dollars, and so there's less development oftentimes than there should be. And in fact, Mayor Rahm Emanuel came to visit with us at the University of Chicago, and he's looking at replicating the second model with students next summer with city dollars as a job program for youth. So we're excited about him moving forward with those sorts of steps. And we take all of this data we have and we put it on a website called southsidehealth.org. And again, this is an instance where we unlike typical academia where you get your data, clean it, and you want to write, do your own analysis, we actually get our data and put it up on the website very rapidly so that it can be used by the community. In fact, 6 weeks after we collect the data, it's up on the website and available free of charge. And this has been very helpful because our community said to us, before you come out here asking questions, you better give us something. You better bring something to the table. So southsidehealth.org is the something. And in fact, the community members have helped us design the hierarchy, how you describe things within the context of the website. This has been a very useful process, one that, frankly, I didn't know that it would be as big a hit as it has been, but has been important for building the trust we need to do our research. In fact, one alderman used this website to make the case for Walmart in this community. I don't care what your politics are. I'm not a big Walmart fan, but he was able to, on his own, use the data that was there to answer a question that he had, which was, how much retail do we have in my ward? And by showing that there wasn't a lot of retail, he was able to make the case that a Walmart should be cited there. We also have a Spanish site that's a companion called Donde Está? Where is it? that we also use as a part of this project, and it's been, all of our work has been translated into Spanish. And this is just to give you a sense, from the first go round when we did the asset map, and I mentioned that we started out with, we now have 11 communities that are asset map the built environment, but we've done 6 of those communities twice, so we can look from year to year, a comparison of what's there and what's not there. And what we found by taking lists we bought from Dun and Bradstreet, among the best list of businesses that you can find, that a lot of the assets that we have aren't on their list. It's as high as half of the assets in our community Dun and Bradstreet doesn't recognize. And so right now, the University of Chicago, through the Urban Health Initiative, has the best list of what's going on the south side of Chicago from a built environment. And so we're actually currently working with our business school to figure out how to monetize this for the PepsiCos of the world. Because we need to figure out how to create a model to sustain our work. And in fact, when we met with PepsiCo for the first time, it was an interesting meeting because they said they wanted to work with us. And Stacy Landau and I were meeting with them, and Stacy said, well, we have to ask our community if they want to work with you. And he sat back and he said, come again? And he said, no, we have to figure out if our community wants to work with you. If they decide they want to work with you, we'll do that. And he sat back in his chair and he said that I've been in a lot of meetings where I'm writing checks, and I've never heard anyone say, we won't take your money until we check with our community. And then, we also had, a map that Stacy, and I'll show you an example of the map that can be generated. We had a map that Stacy generated of grocery stores on the south side of Chicago. And the guy said, where did you get this? And we said, it's on southsidehealth.org. It's free. And he said, well, I was going to pay someone $1 million to do this work. And I said, you can pay us. We're trying to figure out how to have not-for-profits, average person, get our list for no money and then charge those who have money in a Robin Hood sort of approach. And this is just one of the maps. And one of the things that our maps do that even Google Maps doesn't do, allow you to overlay more and more resources. So in this instance, this gives you some of the diabetes-related assets in a community on the south side called Grand Boulevard. So if you look at the red crosses, those are health clinics. The shopping baskets are grocers. And as you can see, there's only one fitness center in all of this area that has a population of probably about 50,000, 40, 50,000. So you begin to see different maps and how health resources are there or not there, and what needs to be built.